Hi, my name is Grace Ng. My clinical background is midwifery and obstetrics nursing, and currently I'm an educator. I'm the Associate Nursing Director at the New York Simulation for Health Sciences, which is located in New York City. And this is a joint center between NYU Langone Medical Center and the City University of New York. The New York Simulation Center for the Health Sciences has been open since September of 2011. We are a 25,000 square feet facility, and we have about 22 simulation rooms. We have many different types of settings to facilitate the learning of nursing students, medical students, residents, attending physicians, practicing nurses, physical therapists, occupational therapists, so we are quite a large center. So Damien Shield and I work together. We are partners in terms of running the center and guiding the development of programs. He and I are full partners in running this together. We have an interprofessional collaboration model that we follow closely, and we hope that it will serve as some kind of a model for the healthcare education and practice community. So we were very excited about the general session. For us, it went from running a scenario, debriefing the scenario, to debriefing the course itself. So in other words, how we put the course together to make it meaningful for our learners, which were actually faculty who teaches at universities, colleges, and hospitals. But the scenario is focused on a mom who had a precipitous delivery, so the baby came very quickly. She was brought into the hospital by the emergency medical services. However, when she was in the hospital, she had a severe postpartum hemorrhage. She had a large amount of bleeding, and the team had to come together to give her the medications and give her some blood to make her better in a very short period of time. We had the team together and we debriefed the scenario. We went through what happened in the scenario. We tried to go through whether or not the learning objectives were achieved. And furthermore, we wanted to hear about what are the takeaway of the participants. So they walked away knowing how to bring the disciplines together with insights on how simulation can help them develop the educational objectives, as well as the clinical practice objectives outside of the educational arena. So Laerdal contacted us and asked us to be the lead in putting this together a few months back. So it's been a work in progress for us and working closely with the team at Laerdal to develop this program. So we put our heads together to figure out what our stakeholders are interested in, and we figured out that faculty development really is key to putting all this together. So we used a postpartum hemorrhage scenario, which is something that's very commonly taught in schools and commonly encountered by practicing clinicians. However, we wanted to bring it back to a larger audience, so we didn't want to focus solely on the postpartum hemorrhage and the obstetrical management itself, but rather how we can use this clinical scenario and the clinical content to bring out the overarching objectives, which is to share our knowledge and some of our experiences on how we use simulation to teach students and clinicians. You know, I have such a positive experience with the SUN event. The Laerdal team has been so great in working with us to put it all together. I also get this great energy from the participants as well, and I could definitely sense that people are here to get together. They want to form a community of practice, to learn from each other, share ideas, and to take us to the next steps. Prior to jumping into the scenario, we also wanted to bring out the point that professionals working in quality assurance and patient safety really want to work with us in terms of using simulation to help us reach the goals, which is ultimately to provide safe patient care and high quality care across the continuum. So we thought it was important to include the part where the administrator who work in patient safety brings his concern to us, which is how do we help the frontline workers implement safe patient care practices to reach the goals.